connected. It's Daybreak, Tuesday's edition, reaching you live from a broadcasting service. Now to the health segment this morning, and we have Dr. Nusa Liberty Aigbe. You're welcome, sir.
Thank you for having me.
Peggy.
Good morning, Jojo. Viewers, good morning.
All right. Dr. Nusa, you're welcome.
Thank you.
I'm aware you're a medical doctor and you practice abroad. Welcome to Nigeria.
Thank you.
All right, you've been around, so how will you rate the medical practice in Nigeria compared to what you have in the States?
Well, first of all, I just want to say good morning to the viewers, and thank you guys for having me here. I think it's very thankful, giving me this opportunity. Well, just to go straight to your question, it's it's always it's always I think it's hard to compare apples and oranges. So
okay, it's hard to compare apple to oranges.
Yes, it's hard and it's difficult. So I think I can go about trying to differentiate between the practice of medicine and healthcare system in the United States and as well as in Nigeria. You can see that the dichotomy and the distance and it's just far apart. So for example, in the U.S. The healthcare system is a little segmented in a way, and also compounded. Okay, what do I mean by that? I mean there's a lot of support. There's a lot of entities involved. There's a governmental entities. There's a private, entities, and there's and then when you put all those things together, so the practice and the delivery of healthcare system in the United States is so complex and at times accessible and affordable, but at the same time can also be expensive.
Okay, it's expensive over there.
Can also be expensive as well. So again, so that's why I said it's fragmented. Segmented. It's compounded, just because of the different dichotomies.
Okay, what do you mean by segmented? When you talk about it's being segmented, what do you mean like that?
No, there are public hospitals. Okay,
Okay.
Then there are private, clinics as well. For example, I run a private clinic and urgent care center in the United States as well.
Okay.
So that's how that's the segmented part of it.
So what do you major on? Are you like a surgeon hired?
No, I'm not a surgeon. I'm a general practitioner. I just sort of do everything, and I like it because it gives me the opportunity to treat different sectors and different patients, including old, new, and everyone.
All right, a lot of our doctors always come, apart from the salary, their upkeep that is low. They also complain about not having facilities to work with. Is that what we have over there, or there too? The facilities to work with?
Yes, we have a lot of facilities to work with. Okay, there's a lot of facilities. There's a lot of, I think the practice of medicine in every part of the world, has to do with having the right facilities, has to do with having the right, equipment and processes and procedures in place. So now it's not to say that in the United States there are not some hospitals that lack some of those facilities, but at the same time, those ones that don't have as much as the other ones, they still have more than what we have here.
Nigeria.
Have you ever practiced in Nigeria?
I have never practiced in Nigeria.
But you have friends that have practiced there?
Yes, I have lots of friends that have practiced.
Okay, apart from you've spoken to some of them, what do you think that the doctors here are doing well compared to the United States? Because there are some areas I believe that we are good in this country. So in what areas are we doing well in Nigeria?
I think one of the most significant areas the folks here are doing well. They love their job. They love their profession. They love their profession. They want to do things. They want to help, but they don't have the wherewithal to carry out those stuff.
Okay. All right. Before you go into your next question, what is that drive that makes you want to establish a hospital here in Nigeria? What is that drive? What is that motivation that makes you want to establish an hospital here in Nigeria?
Yeah, thank you so much for that question.
Okay.
And I think the drive and the motivation has to do with what we've just been talking about.
Okay.
So we're talking about lack of equipment, we're talking about lack of facilities, we're talking about lack of, just the entire, processes of practicing medicine. Like I said, I have friends here, I have folks here, and I talk to them, and when I brought up this idea, they said this is great, and you want to have, you want somebody to come to the hospital, and before you just say, hey, you have malaria, you want it to get tested, you want to have X-ray, you want it to have, CAT scan, if you will, but, and then we also have the issue with, unfortunately, kidney diseases, all right? So I'm not even sure how many, how effective is the dialysis, here works, and those are all going to be part of
the hospital.
Yes, it's all going to be part of the overall concept of the hospital, to have the facilities, that's needed in terms of imaging, in terms of, dialysis, in terms of just, things that most of the things that we do there, just to, bring it here and then translate it into an affordable and accessible,
Do you think, you said something that medical expense is a bit high abroad. Do you think that we have such amount in Nigeria? You're coming here to establish a hospital that will be well equipped. Do you think that we have that amount to go to such hospital, or you're going to subsidize everything for everybody?
No, that's another excellent question. I think when you're trying to create such a facility, obviously there's cost involved,
Yes.
maintenance cost involved. Obviously, you're going to have employees. Obviously, you're going to have to pay these folks, right?
Yeah.
So yes, there's going to be some subsidized care, but it's also going to be those who can pay.
Subsidized care. I love that aspect of it because the country is hard, and you're around, you know what's going on, and people just want. They don't have the ability, they don't have that access to good medical care. So subsidizing it will be very good. Kudos to you for that. Kudos to you. And when is this coming up, and where is this hospital going to be? Because we just want to know, because especially talking about the subsidized aspect, I'll be interested to know where it is. When are you starting it? When are you laying the foundation? And how soon are we going to assess this place?
So we actually laying the foundation tomorrow by 12 noon. It's at Rock Bar Community by Erie off Airport Road.
Okay.
So that's where we're having the ceremony tomorrow. So, and again, this is something I'm looking forward to. I've been dreaming about this for a very, very long time. So I'm hoping that we can see this to fruition.
All right, have you done any free medical outreach to people, especially within that community? I believe that can still. Have you done any?
Oh, that's part of the program we're planning.
For tomorrow?
Yes.
There's going to be free medical outreach, like eye care, giving some drugs. Is that what you're planning?
That's what we're planning for not for tomorrow.
Okay.
That's going to be part of the plan, going forward, but not for tomorrow.
Oh, not
Tomorrow
for tomorrow.
is just to introduce the community. We're laying the foundation.
Okay.
We're opening the place to the community and let them know, hey, this is what is going to be.
So are you looking at some hospital maybe just for children or for the elderly? The one you are bringing down to Nigeria, is it for just elderly or for children? Or?
Yeah, like I said, you asked me in the beginning, what is my specialty, and I said I'm a generalist. Because I want to be able to affect every works of life. I want to be able to affect every individual. So it's not just going to be just for one person. It's going to be adults, kids, pregnant folks, elderly folks, just disabled folks, everybody. And then another aspect to the hospital is, over there we have what we call elderly home, elderly center, senior living and whatnot. So that's going to be part of that hospital. Okay? So most times, I think the drive that was, a lot of the time we have a lot of our brothers in the diaspora. They have their parents here, and at times they need a place where they can be well taken care of. So the adult home is an inclusive but different part, of the hospital. But in general, this is all going to be everything.
Oh, thank you, Dr. Nosa Libati Aigbe. You are from Edo State.
Edo State, Benin City, I'm a Benin boy.
Oh, it's making us so proud.
Yeah,
A lot of
boy.
persons we have this money and take it elsewhere and do something over there.
Else.
But this man, our son is here in Edo State trying to bring something to us, and I believe that will create jobs for a lot of persons. We are so happy, and we wish you well from this place. We wish you all the best during this program. But my question is this: are you relocating back? Because are you like leaving that place and coming to this place?
That's a good question, and it's a very valid question. And at times when you have a structure as huge as this, it's not something you want to just abandon. It's not something you just want to just let it fly and, take care of itself. So there's going to be some presence here. There's going to be a lot of, you will see me a lot.
All right, before I let you.
This last question before, it's good to build a faster hospital, but I know it's very, very critical to sustain this equipment. So how are you going to sustain this process, this drive now you are trying to do, the hospital that you want to build?
Okay.
How do you sustain it?
I think,
because we have seen some hospital before, after building it, before nothing is happening there again. So how do you sustain it?
I think we touched about this earlier, about number one, subsidy, about, how you create a project, and then for me, I think the sustainability is a key, and that key is part of the plan. And most times folks do things before you go into this kind of, you have to plan it, right? So you have to have a concept of what you need to do. That's a very good question. So now you have this medical facility. How do you sustain it? Patients come in, you drive some revenue from there, and then the other thing is that the facility, the hospital is going to be connected to a foundation. Okay, so we have a foundation. I have actually two foundations. One is Laborde Community Health Foundation here, and I have another foundation, Project Health Africa. Okay, that's in the United States. So the goal is to sort of raise a lot of funds, not only doing other medical outreach in other part of Africa, like in Gambia, but also trying getting some funds from there to also maintain this hospital in addition to the revenue this would be bringing up.
All right, Dr. Nosa Libati Aigbe, medical MD, Liberty Hospital, Benin City. Before I will let you go, a lot of our doctors here, they're finding things difficult. There's this strike, you see them going from one strike to another. What do you think can be done? From you've been there, you've seen how things have been wrong. What do you think that government can do so that can stop this incessant strike, these doctors going on strike, and people are just left on their own?
Yeah, I think, like you said, some of the doctors I've spoken with, they don't need much. Number one, they need a good place to practice.
A good place to practice.
Number two, pay them when they do their job. So it takes, if you calculate the amount of time, especially in the United States, if you calculate the amount of time you go to school, for me it takes about, just not counting secondary primary school, it takes up to about 12, 13 years. Okay, so I know it's a little different system here, but at the same time, and it all adds to the same time. So these folks spend countless amount of hours studying, countless amount of years studying, foregoing families and foregoing a lot of other pleasurable things. So
yeah, I agree with
once
you.
they get to that place, and then they still have to, go through other hurdles, like lack of payment. I mean, somebody cannot be working for 3 months, you can't pay them. That doesn't, that I don't think that makes too much sense. I think, that's one of the things they're talking about. Pay, they want to be paid good, they want to be paid higher, they need a better facility to work with, and they just, and I think they also need to be respected and be heard. I think once we start having those conversations, I think some of this incessant strike will start reducing.
And you have this in the United States. They pay them very well, the medical doctors. I believe that's why you see a lot of them running away. And somebody just said that the medical doctors are leaving. Soon as we'll just be having native doctors all around. I'm like, wow, government should just do the needful. We need it, but more commendation and kudos to Dr. Nosa Liberty Aigbe, who is trying to do his part to ensure that people have access to affordable medical care. We have the Edo Health Insurance Scheme also. A lot of us are into it, and kudos to the governor. And you are coming from the private aspect of it to do your part. We wish you well. Tomorrow is the foundation laying ceremony, and you just have to be there. A lot of you just need to go along Airport Road, Aroba.
Yeah, Aroba community.
Aroba community.
Yeah,
Along
Iri.
Yeah.
Along Iri. Just be there. Just support this young man. Let's support him, because sooner or later, most of our sons and daughters will be working there, and at least there will be prosperity in the land. We want to use this as an opportunity for others to come home. Edo is safe.
Yes.
That's why you are
Yes,
here.
it's
Edo is safe.
Very
Yes.
safe, right.
And others should come, so that a lot of investment will be going on from this place. We wish you the best, and if possible, we have to be there also.
Yes.
Can't wait.
Again, to stay with you, to say this is our son and it's making us proud. Thank you, Dr. Nosa Liberty Aigbe is the MD Liberty Hospital, Benin City. All right, that's the much we can take on this segment. Daybreak continues after this time, and please stay.